Participation in sports gives young people opportunities to have wonderful experiences. As members of a team or as lone competitors, young athletes learn valuable lessons that help them grow and develop as people and members of society. Unfortunately, injuries can happen anytime, anywhere. As a coach, athletic director, or volunteer, you do everything possible to prevent an injury while being prepared to deal with one. You should consider taking classes in CPR, basic first aid, and specialized coaches training if available in your area. When an injury does occur, you need to assess the situation and know immediately if more help is needed. Approximately 4.5 million athletes between 5 and 18 years old are treated in hospital emergency rooms for sports-related injuries each year. As young people mature, their muscle groups develop, and they're more susceptible to injuries if they're not physically or emotionally prepared for certain activities. Sprains, strains, contusions, abrasions, and lacerations account for around 60% of all sports injuries to students. Generally, the younger the person, the less severe the injury. But it's important to remember that the faster young people grow, the more likely they are to be injured at bone growth sites, like the knees, shoulders, hip, and back. Most schools and associations require a complete physical before a student participates in sports. This is largely the parent's responsibility, but as a coach or athletic director, you need to be aware of conditions or previous injuries, which could be cause for concern on the field. Another important step is making sure the child is properly conditioned prior to diving into competitive sports. Skilled coaches require athletes to run or engage in some other kind of physical conditioning activity about 3 times a week before the start of the season. Young athletes should be encouraged to condition on their own as well. This initial period of body tuning is a great time to watch for signs of a potential injury or medical condition in a student. For example, a young person may favor a leg or exhibit extreme fatigue. Don't rely on the athlete to volunteer information. Approach them about any concerns. Most students are not very communicative about their bodies, especially around their peers. To prevent dehydration, always keep plenty of liquid available for athletes to replenish body fluids lost through sweat. A proper warm-up is more important for students participating in sports than it is for adults. For young athletes going through growth spurts, tight muscles and tendons need to be loosened prior to playing any sport. Before any game or practice, a typical warm-up lasts about 15 minutes. Mild aerobic exercises like jumping jacks are sometimes followed by sport-specific activities like shooting a basketball or catching and throwing a baseball. It's also necessary to focus on major muscle groups. Stretch leg, torso, arm, and neck muscles. If a student takes a break, an experienced coach insists on about 5 minutes warm-up before rejoining the competition. A cool-down period following play or practice is also recommended. Once students are on the field or on the court, it is up to the coach to provide the next level of sports injury prevention, skills instruction. Consider how much skill it takes for a young person to handle a ball with a lacrosse stick and avoid hitting another player, or a soccer player to attack the ball aggressively without hurting someone else. Focused and sometimes individualized skill instruction by a coach can help students gain better coordination and control. Fast-moving limbs and plenty of action are part of most sports games. Rules are set for both fairness and safety. Any sport can become a dangerous game when fast-moving players and objects make contact with one another. Recognize fouls and use penalties to show young athletes how to play respectfully and safely. For instance, it's dangerous and against the rules in football to spear. That's when a young player tackles another player with his head down. Younger, inexperienced players may need tighter rules so less coordinated players don't hurt one another. Protective equipment, face masks, mouth guards, shin guards, protective padding, and eyewear are invaluable for students participating in sports. One of the most important things a good coach can do is insist upon the use of protective equipment when students are practicing or are engaged in a sport. Each sport has its own set of hazards. For example, hockey calls for face masks, padding, mouth guards, and shin guards. Basketball calls for mouth guards. Baseball demands special batting helmets and padding. Other personal protective equipment may be recommended. Coaches and athletic trainers should let each student know what equipment will be necessary for each sport. Students should have their personal protective equipment properly fitted and know how it protects them. Incredibly, 30% of eye injuries among students under 16 are sports-related, and eye injuries are also the leading cause of blindness in young people. The environment young athletes are playing in, with fast-moving balls and fingers and elbows flying, can be a war zone to an area of the body as precious as the eyes. Ophthalmology professionals recommend that students wear shatterproof goggles made of 3mm thick polycarbonate. Such eye protection is inexpensive compared to the value of having one's sight. Once a student is conditioned, trained, and properly equipped, the next step is to make sure the field is in good condition. Remove debris from outdoor fields. Always keep an eye on the weather. At the first sign of lightning, clear all outdoor fields. Make sure indoor courts are dry and clear of spectators who could interfere with play. Field equipment like padded goalposts and clean, undamaged wrestling and gymnastics mats should be in place and inspected. Children are starting to play organized sports at younger ages than ever before. For activities such as gymnastics and soccer, participation can begin at a very early age. And in some cases, athletes practice 5, 6, or even 7 days a week. Physical fitness is an important aspect of a child's development, but a child's fast rate of physical growth, combined with a high frequency of workouts, can lead to growth-related injuries at very early ages. One such disorder is called articular osteochondrosis. This is a particular type of damage that can occur at joint growth sites, such as knees, hips, and elbows. A similar injury can occur at non-growth sites, like tendon attachment sites, called non-articular osteochondrosis. Osgood-Schlatter's is one of these diseases. Children have growth plates at the ends of many bones. These plates are susceptible to fracture due to overuse or high impact. Tendons and ligaments are often injured as well from frequent activity. If you notice a student experiencing pain and in some cases tightness of muscles and ligaments, it could be a sign of injury. Sometimes an unusual walk or a limitation of joint motion indicates a trouble spot. Rest is usually the best treatment. Once the student returns to that activity, the workout schedule should be modified to allow them to participate in drills and skills practice without experiencing pain. Some injuries don't get better with rest. Those need medical evaluation. Many types of injuries can occur on the field. Cuts or lacerations should be treated with care, cleaned and dressed with a self-adherent wrap that won't stick to the wound. Standard precautions for the safe handling of blood should be followed. Wear disposable latex or vinyl gloves when tending to an injury. If the wound is serious, medical attention should be obtained at once. A charley horse is a common sports injury. It's a contusion of the thigh muscle that causes bleeding inside the thigh. While very painful, they are rarely serious. Treatment includes rest, an ice pack, and elevation. The athlete should be sidelined until the pain is gone. Finger sprains are common in every sport, especially football and basketball. Don't play doctor with finger injuries. If you see swelling, pain, and severe stiffness, apply ice and compression, then make sure the student gets to a physician right away. Young athletes can have muscle cramps, usually in the thigh or hamstrings. These conditions are not serious and should be treated by stretching the muscles, by flexing the ankle and pointing toes up towards the head until the pain goes away. Ankle injuries are common to all athletes. In all cases with damage to the ankle, a doctor should be consulted. Discoloration, pain, and swelling are symptoms of a sprain or other injury. The ankle should be immobilized and iced as soon as possible. Ankle injuries can vary in severity and take a long time to heal. It is important that the student not return to action until the ankle has fully healed. You should be prepared to act in all emergencies. There are several situations in which the only thing to do is seek immediate medical attention from professionals. Contact, even non-contact sports, can sometimes result in damage to a student's teeth. If a tooth is knocked out, it should be found, if possible, and placed in a sterile dressing. The student and tooth should be sent to a dentist immediately so the tooth can be reimplanted. Save the tooth in fluid, like milk or even saliva, if it will take longer than 30 minutes to get to a dentist. Teeth can be saved for up to 12 hours this way. A doctor should treat any significant eye injury. In cases of injury to the eyeball, a sterile eye patch along with soft crushed ice should be applied and the student sent to an emergency physician. Orbital fractures of the bony frame around the eye are characterized by severe pain, double vision, or possibly cuts or bruising. A physician should treat the student as soon as possible. Among the most severe sports injuries is damage to the neck, head, or spine. Young athletes, due to the immaturity of their bones and ligaments, are more susceptible than adults to this type of injury. Partial or total paralysis can indicate a spinal injury. In these cases, do not move the athlete. Seek immediate medical attention. If the injured player is wearing a helmet, do not try to remove it. Emergency medical professionals will determine the best course of action. Without disturbing the neck, if possible, try to remove the face mask to allow access to the athlete's airway. Keep the student still and gently prevent the head and neck from moving, as this could cause further injury. If you suspect a student has a concussion after an injury of the head, he or she should be observed on the sidelines. Concussions cannot be treated. They need to be medically evaluated. Symptoms of a concussion include confusion, slow responses, disorientation, disjointed statements, memory deficits, incoordination, and emotionalism. Loss of consciousness is a severe symptom. Medical assessment should be sought immediately. One of your many duties is to make sure that whatever the sport, it's fun and challenging for all involved. Knowing an injury could occur shouldn't keep young athletes from having a good time while playing, or you from enjoying your part of those activities. You have a big responsibility. Sports injuries have increased greatly over the last 20 years. Coaches, as well as parents, are important in reversing that trend. We can reduce stress for students by being more relaxed ourselves. Positive sports experiences teach lessons that carry over into all parts of a child's life. As coaches, we need to let young athletes know that winning isn't everything. The chances of being injured are much lower and the fun will be greater if students just go out and play. You can prevent many injuries before a game begins. Watch your team closely and make sure players are conditioned and warmed up before games. Provide students with the proper protective equipment. Encourage them to be truthful with you or their parents anytime they think they may have been hurt, even slightly. Clear playing areas of hazards. Be aware of the symptoms of common injuries. Know basic injury treatments. Know the signs of serious injuries and when to call in medical professionals. These precautions on and off the field will make young athletes winners.